I think that there is a misconception that when you think about chronic absenteeism, that you think it's just the kids. But if you are an adult in the ecosystem that is responsible for helping to educate that child, whether you're a teacher, whether you're the bus driver, whether you're a primary caregiver, and you are chronically sick, that has impacts on a student's ability to get to school and to learn because they're having to take on that burden of the adult. So the impacts around the quality of healthcare for the entire community is just super important.
Try to fix the current system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As healthcare leaders, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the week about what else? The announcement of ChatGPT Health. Why is the consumer point of view underrepresented in how the provider community is initially responding? And why is it important to lead with optimism as we learn how it works? I'll talk about that. Then OnMed CEO Karthik Ganesh joins me once again, along with Alan Washington and Earl Phelan, for a real conversation about how health drives learning and other important aspects of the connection between access to healthcare and academic performance. I'm Jared Johnson. Let's get it. Flava of the week. Does anyone else feel like we're going to have plenty to rap about in 2026? Look no further than the announcement of ChatGPT Health, the biggest headline since Amazon's acquisition of One Medical 3.5 years ago. OpenAI announced the launch on January 7th, describing a dedicated experience that securely brings your health information and ChatGPT's intelligence together to help you feel more informed, prepared, and confidently navigating your health. Translation: until now, getting personalized answers about your health meant manually collecting records from multiple doctor portals and uploading them yourself. Now, ChatGPT, if you choose, can connect to all your health records across providers, understand your complete health history, and give you truly personalized answers to your health questions, which is highly relevant because, according to their own data, over 230 million people globally ask health and wellness-related questions on ChatGPT every week. Also significantly, Be Well Connected Health was selected as the underlying health data connectivity infrastructure, enabling users to securely connect their medical records for more personalized health AI interactions. According to Imran Qureshi, Be Well's CTO and Chief AI Officer, it combines ChatGPT's advanced AI capabilities, Be Well's largest health data network in the country with 2.2 million doctors and 320 health plans, and the Be Well Health SDK for AI, purposely built for LLMs. The example he gave on LinkedIn was that this allowed him to instantly connect to 15 years of records across all of his health systems, pulled in all of his lab results automatically, and generated a clear visualization of his cholesterol trends. This allowed him to have an informed conversation with ChatGPT about managing his cholesterol. What's the consumer lens? As usual, the consumer point of view is important, yet so far wildly underrepresented in the points of view being posted and shared by the provider community. This is really big, y'all, and I hope the industry grasps it quickly because simply they can't stop it. There's nothing they can do about it. I find myself siding with well-known advisor, board member, and Columbia Business School adjunct professor Hallie Tecco. She said, "You will not stop patients who are frustrated with rising costs and impossible access to our current system from using these tools. People are now using AI in their daily lives. It has already replaced search, and now it's replaced WebMD and Dr. Google too. I would much rather the OpenAI team work with healthcare experts, which they are, to build something better. If we work together, we can hold them accountable for safety, quality, and security, all very real concerns, all while giving patients access and information we deserve," unquote. So as we go through our due diligence as an industry in the coming days and weeks and ask those hard questions about security and privacy and safety, I hope we lead with optimism rather than excuses. I hope we're driven by the opportunities to give people the answers they haven't been able to find in an opaque, convoluted system on their own, because those answers, at least for some, are now going to be just a prompt away. Let's lead with optimism as we see how ChatGPT for Health changes the trajectory of healthcare interactions. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. Hey, I'm here with my friend Carol Flagg from Healthcare Now Radio. Carol, you and I have an exciting new partnership that we want to tell people about.
Yep, we'll actually be launching an exclusive new opportunity called Limited Series. And these series will air nationally on Healthcare Now Radio, which, by the way, was named once again as one of the top 10 healthcare shows again in 2025, as well as here on the Healthcare and Wrap. These series are going to cover some of the biggest topics in 2026, starting with rural health and including the CMS health tech ecosystem, GLP-1s, wearables, and more. So we're really excited about these series because there's a lot to talk about with these topics, which means they are ideal opportunities to create thought leaders in these spaces.
Yeah, Carol, that's what I'm the most excited about, is to really generate more informed, trusted information on these topics. And for those who are interested, spots are extremely limited for Q2 through Q4 of 2026. To get started, just reach out to either of us on LinkedIn, and we look forward to hearing from you. Hey y'all, I'm here with Israel Crush, founder of Hyro. Israel, what's an easy to understand example of how an AI agent can help consumers in their health journeys?
A simple section would be the fact that instead of enrolling into Medicaid and proving that you're eligible once a year, you need to do it once every 6 months. Patients don't know that. So we said, you know what, we're going to get ahead of that and we're going to educate patients about some of those changes and try to get them re-enrolled or redetermine their enrollment into those programs to make sure that one, they're covered, and two, that the health system gets paid or reimbursed for those patients. So I think that's like a clear win-win where you create an AI agent that is proactively helping both patients and health systems with issues that they face and make, again, the journey a little less complicated.
Thanks, Israel. Visit hyro.ai for more information. That's HYRO.ai. And tell them you heard about it on Healthcare Wrap. All right, everyone, let's get into the flow. We have a full panel. I have Karthik Ganesh back, CEO of OnMed. Karthik, welcome back to the show.
Thank you.
We also have a couple of other guests here. We have Alan Washington and Earl Phelan. Alan, welcome to the Healthcare Wrap.
Thanks so much. Thanks for having me. Great to be here.
And Earl, glad for you to join us as well.
Yeah, awesome to be here. Thanks, Jared.
Karthik, let's start with a refresher from you. And then Alan, if you want to just give us like a brief intro, and then Earl, and we'll go from there.
Sounds good. Jared, glad to be back again. Karthik Ganesh, CEO of OnMed. We're changing the healthcare access landscape. And I couldn't be more excited to be part of today's conversation because it's one thing to make a difference in the lives of so many. It's another thing to do it to make a difference in the lives of kids, and then to do it with a person I feel like I've known forever, though I haven't known him that long, like Alan. I'm just very excited to talk about what we're going to be doing together. So glad to be on the show, and Alan, I'm really privileged to be on this journey with you.
Feelings mutual. Thank you. So I'll go here. Alan Washington, CEO of 22 Beacon, and we are a 30-year-old national nonprofit that has what I call a deep purpose to break the barriers that prevent children from accessing great quality education across this country and beyond. And we have primarily been focused on breaking the barrier of facilities and the access to facilities, particularly for charter schools in the country. But one of the things that we have learned through our conversations with school leaders like Earl and others is that healthcare is another critical barrier that prevents children from accessing great education. And so we at 22 Beacon are so thrilled to be able to not just talk about addressing that barrier, but actually having a solution. And like Karthik mentioned, I feel that we have found our true partner to be able to deliver on this challenge. And so excited to be here for the conversation and excited to be here with both Karthik and Earl, two visionary leaders who are really driving to make impact in our world.
Well, thanks, Alan. My name is Earl Martin Phelan, and I'm with the Phelan Leadership Academies, a nonprofit public school network named after my mom and dad. And we go into underperforming schools, 24 schools, serving about 10,000 children, grades K to 12 in 5 states, mostly in the Midwest. And it's a pleasure to be here with you and a pleasure to explore how we continue to support our scholars and being their best versions of themselves.
Maybe a good starting place is kind of what a couple of you already referred to in terms of the connection between access to care and academic performance, because I think that's kind of what we're all referring to. Maybe Alan, what have you seen in your own work and life that shows how health drives learning?
What we know is that chronic absenteeism is going in the wrong direction. So back in the COVID days, about 13% of all kids were chronically absent. That number is now close to 23%. And if you look at the higher grades, in particular, right before graduation in high school, the percentages are even worse. 2, we know that when kids are chronically absent, they are less likely to graduate. And when they don't graduate, it has implications not just on educational outcomes, but also on the ability to have access to greater income across their lives. So those 2 things alone, to me, are startling statistics that I think are crisis level, that everybody who's hearing this should want to say to themselves, okay, how do I solve this and how do I address it?
Alan's points are supported by some pretty hard-hitting numbers as well, right? So I think chronic absenteeism ranges from 15% in a lot of parts of the country to 51% in New York City. And the numbers, I'm going to read some numbers out to you, which I think are stark and double click on Alan's point there. Chronic absenteeism results in a 700% higher dropout rate, 350% higher incarceration rate, reduces 9 years in life expectancy. And as a result of that, 200% of those kids are more likely to live in poverty. So what we're doing here together has the ability to, quite frankly, break the cycle of generational poverty in a lot of cases. So the impact is just absolutely breathtaking in terms of being able to deliver on this promise together.
The communities where the Phelan Leadership Academies reside are low-income communities, the toughest parts of Indianapolis, toughest parts of Detroit, Alabama, and Ohio, and so on. And so our scholars already have systematic health issues, i.e., most of our schools are in food deserts. Most of our scholars have heard gunshots in the night, which obviously can affect your mental health. Because there are food deserts, a lot of our scholars don't get access to the fruits and vegetables, and the other nutritious proteins and other things that we need to be healthy. And so just think about it as a child. If you come to school and you're hungry because there was no food over the weekend, well, that affects your health and that affects your focus. And so that's not even the kids who are chronically absent. Those are the kids who actually come to school, but also have an impediment because of health barriers. A lot of our families are either unemployed or underemployed. And so as our federal government attacks the health rights of U.S. citizens, we need programs like this that are going to support healthy families, which means healthy children, and then children who are ready to learn.
Let's talk about the students themselves, right? When we're talking about students in underserved communities, like you said, so many of them face major barriers. It feels like people are generally aware of that, but when we really start talking about like those access gaps, I don't know if a lot of like the general public makes the connection of what's important, what the cause and effect of that are. What are some of the biggest access gaps that you all are seeing? And I wonder how we get those gaps, like how they show up inside the classroom and then downstream from there, like just to kind of shine a light on that.
If I'm hearing you correctly, some of the access gaps are systemic. If you go to a school, an underperforming school, an F-rated school, and you don't get a quality education, then you're less likely to be in a position to either go to college or access a good job. You're less likely to have a full set of benefits that are paid for, right? So you have that part. You're more likely to have unstable housing. You're more likely to be in a part of the city where actually transportation isn't consistent, so it may cost you any job that you have. So you start to see those things play out, and they play out in terms of how our scholars show up. So our scholars are brilliant. They're genius. They are the smartest, most resilient kids, probably at least in this country. And what we want to do is then give them resources like OnMed that take out some of those barriers. Because if you don't have regular health care, or you can't get a primary physician, or you can't get an appointment because you can't take off of work to go to get the appointment, being able to get basic health right there at the school site for both the scholars and our staff and our families is a major impediment that OnMed removes for our children and our families. So we're excited about it because we know it's going to help our scholars be healthier, and clearly that's a part of their success in school.
You covered it extremely well. I think the only thing that I would add on to this is I think that the other great opportunity that we have here through the OnMed Care Station is that for those families that do not have insurance, they're still able to access care. And I think that is a big, important game changer here.
Earl and Alan, really well said. I think the Earl used what I think is probably my favorite word in the English dictionary, which is the word resilient. Resilience is as much about what you find within and the strength you find within as it is about the support system that you have around you that can constantly ensure or help ensure you bend but don't break. And the beauty of what we're doing, and Earl, again, beautifully alluded to it, was the fact that this is as much about the kids as it is about their caregivers and their parents, as it is about the school staff, because in that trifecta or the tripod, even one leg buckling impacts the others. And you almost want all three to be able to go to bed each night knowing that health and health care won't be a factor in tomorrow being a better day than today.
I think that's well said. I think one of the things that I'll add on to that is I think that there is a misconception that when you think about chronic absenteeism, that you think it's just the kids, right? Many people think, oh, it's the kids. But if you are an adult in the ecosystem that is responsible for helping to educate that child, whether you're a teacher, whether you're the bus driver, whether you're a primary caregiver, and you are chronically sick for whatever might be the reason, that has impacts on a student's ability to get to school and to learn because they're having to take on that burden of the adult in their life. So the impacts around the quality of healthcare for the entire community is just super.
Hey y'all, I'm here with Sina Arham, founder of Friday's Health. Sina, what do you think is broken in the traditional approach to metabolic health, and what are you doing to flip the script?
Let's be honest, the moment in metabolic health is being driven by the GLP-1 receptor agonist class of medications, right? We finally have something that is addressing metabolic health, obesity, and type 2 diabetes in an elegant fashion, right? It's efficacious, it's manageable for patients. And so I think we're having our moment in metabolic health in that the old guard of tackling metabolic health and obesity has a lot of stigma attached to it, a lot of shame and blame and guilt.
Thanks, Sina. Visit joinfridays.com for more information and tell them you heard about it from the Healthcare Wrap. I'm curious what you think about why schools are such a powerful place to deliver that care. Now we're talking about great things that are starting to happen right now in bigger numbers here. Why is a school just a powerful place for that to happen? And then why is this the right moment to do more?
Other than perhaps a house of worship, the school is the center of a community. And it's the place that is often the closest to where people live and the place that the adults in the children's lives access the most on a daily basis. And so to be able to bring healthcare to the center of the community and do it in a way that is accessible at hours and times that are convenient to the entire community, to me, is game changing. I think the other thing that I want to point out is to do a traditional bricks and mortar healthcare building takes millions of dollars and takes years to construct. Whereas the care station solution is something that we're able to deliver with OnMed quickly, efficiently, and can also scale that so we can actually see the impacts happening much faster.
Yeah, Alan captured it perfectly. The only word I'd add is trust. Our families trust us, and we're a place of love. We're a place of support. We're a place of community. And so when you have this resource in a place that is trusted by the community, it will be a game changer.
We've talked about this before, right? You do a lot of podcasts with healthcare leaders. Healthcare has never been a field of dreams. If you build, they will not come. You have to both Alan's point and Earl's point, you have to bring healthcare where people are naturally congregating already. That's the only way you can truly create healthier communities that have a greater sense of well-being. You have to bring care to them. And to Alan's point, schools are right there at the top of where kids, parents, the community congregates in one way, shape, or form.
All good points. And I think that just underscores the interest and the support of things like this partnership with OnMed and 22 Beacon, which I'd like to dive into a little bit. I'm wondering how that came together and kind of what the model looks like on a day-to-day basis inside the schools. I'd just love to hear a little bit more about that. And hey, Alan, tell us about that. Kind of like, how did that come about?
One of the things that I tell our school partners all the time is that when they are embarking on some sort of project facilities related, it's critical that they have A-plus partners working with them in order to deliver on that project. And so for us, anything that we do as an organization, we try to live by that as well. So Karthik and his team at OnMed are that A-plus partner for us in the delivery of the healthcare, and then partnering with A-plus school leaders like Earl makes that synergy just so fantastic and wonderful. When we were thinking about how we were going to address this issue of healthcare, the thing that we were most focused on is something that was, one, going to be free to our schools, two, was something that was going to be innovative and scalable in a way that allows us to be able to have the most impact rather than sort of the bricks and mortar example that I mentioned. And so when I had the opportunity to meet Karthik the first time and to understand what he is doing, it's not about healthcare. It's about, as I like to say, changing the world. That's ultimately what we're all working on together here in various ways, is to change the world. And so that's how this partnership came to be. And I'm just thrilled in terms of what the impact is going to be that we're going to make together.
Jared, I couldn't have said it any better. Changing the world. And I always love it each time Alan says that. That's how Alan finishes his one-on-ones with his team. And that's how he wraps up his interviews when he's interviewing for people to join his team. His last question to them is, are you ready to change the world? And if they sound even remotely ambivalent, they can go back to working their resume. They're not getting that job. So I love that about him. I think you've seen this about in just this short conversation, right? There is a humanity to the man that stands out. When you're looking to change the world, when you're looking to solve big problems, you understand that it has to be a team sport. You can't do it by yourself. And you want that team to be filled with like-minded people who bring a very healthy dose of authenticity and purpose. And it's exactly what I felt the first time I met Alan. In about the first 5 minutes, it was very evident to me that there was a reason we were connecting, and the ability to make a difference together was just the universe's way of saying, let's put these two guys together and to make a difference. And then Earl, I listened to you in this conversation today, and the first time I get to meet you, and I feel the exact same thing. It is, I can't come up with a better word than authentic. There's an authenticity to you that is just heartwarming. Just bless you and your family for doing what you're doing for these kids. And just looking forward to being on intersecting our journey with yours at some point. And Alan, just very fortunate to partner with you as well.
I would appreciate being able to bring all that into the conversation. Karthik, maybe we can dive into a couple of just points that are helpful for people to hear about in terms of data that's out there or insights and observations that you've gathered. Because you have OnMed care stations that are already being established on a number of college campuses and youth centers. There's also data from OnMed about like how employers are being affected in a positive way and the lift there too. Maybe we can dive into some of that just so people can hear like that this isn't just this definitely isn't the field of dreams, and it's definitely not just aspirational. Like there's data to show already an impact on these things.
If I could just share some numbers, and maybe I will take a rural health example in this one, because it will mirror what we see in terms of a lot of under-resourced communities. 78% of the people who come to the care station from a rural community tell us that we are their medical home. They have no place else to go. 49% of them have chronic conditions. Coming back to the example that Alan gave earlier, chronic conditions that are unmanaged or where you don't have the ability to access care for them just catapults into something that just requires constant ED visits and associated admissions with that. The second thing, 58% of the people who come to the care station tell us that if they hadn't come to the care station, they would have gone to the ED. And we know emergency rooms are just absolutely overflowing. 70% of the people who come to the emergency department are for non-emergent reasons because they have no place else to go, right? So we look at all of those statistics, and then we look at the fact that for employers, and we talked about in this instance, the school, not just for the kids from an absenteeism standpoint, but the school is an employer of the school staff. The employers that we have rolled this out into, on an average, are saving north of $1,100 per employee. And that's even without the care station being full at this point. As they start rolling out more wellness programs, as they start rolling out a greater push around employee health and wellness and engagement inside of the care station, this has the ability from an absenteeism standpoint and productivity gain standpoint to have a 15x return on investment. So what excites me about this, there's just a number of very hard-hitting points from an ROI standpoint on this. We've talked about breaking the cycle of generational poverty as it pertains to these kids and giving them an opportunity to do this for the caregivers as well as a part of that. But the ability for schools that are already under-resourced and are stretched financially to now have a healthcare solution drive significant productivity gains for them it's a game changer. It is how we are supposed to do things, especially in America, where we can bring Swiss Army knives to the table and just have it do multiple things because one thing doesn't have to just solve one singular problem. And that's what excites me. I think about the employer, and the question was well asked, Jared. There's an employer aspect to this. There's a child aspect to this. There's a underserved parent aspect or the caregiver aspect to this. And healthcare, if most things in life at the end of the day converge around health and wealth, you can't have wealth without health. And this is the perfect integration point for that across these three stakeholders, if you will.
So well said, Karthik. And Earl, would love to get your take on this. But one of the things, Jared, that I think is at a school level that I'm really energized about is that when we think of some of the top reasons for children or others to be chronically absent or ill, it relates to things like diabetic care. It relates to things like mental health, right? It relates to conditions that the care station can actually diagnose and treat. And so when you are able to attack those primary reasons of absenteeism at school right there and not have to delay that, to me, that's the thing that really makes this impactful from an educational outcome perspective. And then also all the things that Karthik mentioned across an individual's life, right? That's really what I think. And bringing it into a school and doing it quickly and safely and securely and efficiently, like now, is really something that I think makes this the right solution. So, Earl, I don't know what you think about it.
Karthik hit it, you hit it. Most of our families, unfortunately, for a variety of reasons, only use the emergency room for healthcare. And so our ability to bring this to them in the school at all types of hours, since our schools are open pretty much 24/7, not quite, but feels like 24/7, and to be able to have the privacy that comes with the care stations and then the treatments that come with it, I think is going to be, Karthik talked about the ROI, I think it's going to be another game changer for our families. We have 10,000 families or 10,000 scholars. We have 20,000 parents. And we have 1,200 employees. And to be able to support each and every one of them in being healthy is something that will deepen our relationship with them and will have the impacts that both Karthik and Alan spoke to.
Earl, I'd love to dive into that a little bit more too, just in terms of the family side of all of this. Families very frequently bear that brunt of the transportation, the missed work, the limited clinic availability, all the pieces you were just describing. So when you talk about families within that broader community, what's that next level effect in terms of how that, as families are able to better access care in these communities? Like, how does it just kind of, it feels like there's very clearly like a ripple effect at some point where that's not just affecting an individual or a family in a good way, but like the broader community.
Yeah, and we haven't talked about it, but you hit it. Most of our scholars have older siblings who are out of school at this point, right? 20-year-old older siblings, 30-year-old older siblings, XYZ. So everything PLA does is focus on families. And so in as much as this is able to not only reach our scholars and our staff and their parents, but also family members, now all of a sudden you really are having a massive impact on a community that, again, the Far East side of Indianapolis, our scholars are expected to live 16 years less than literally a community that is 5 minutes away from us, right? So 16 years. And a big part of that are all the social determinants of health, but health care and access to health care resources is a massive part of that. So we just feel really blessed that we're going to be able to bring this resource to our scholars as another way, and to our families and to our staff as another way to continue to help our children be the best versions of themselves.
I'm excited about getting this done and focusing on sharing this opportunity really with the world out there, demonstrating that this is what is the solution, and really accelerating this in 2026 so that we can all show really the power of was. We all believe, we all know. Now it's time to get this moving. So that's what I'm very excited.
Good place for us to kind of wrap the conversation is to think about, okay, so what comes next as we start to get even more momentum here in terms of scaling this model to schools and districts nationwide, and we start getting more points that we can connect. And it's more than just a trend or an individualized or localized area that can see the benefits of this, but it starts like this, the scale of what this can do for individuals, families, communities. It can't be ignored at that point. So I'm excited to think about that. I just wonder what the three of you you see as that shared vision for the future of, let's just call it like the future of school-based healthcare?
That vision is that the care station from OnMed is the solution for healthcare for the K-12 space across the country, full period stop. That's the vision. And for those of you who are listening to this, right, that vision only happens when there is support from organizations, philanthropic organizations, private organizations, and governmental organizations. So it's really a call to action for all of you who are out there listening to this, because at the end of the day, as I mentioned earlier, we want to bring this to schools like Earl's and others free of charge. And so that's going to require support and help from many.
The only thing I would add to that, Jared, is that this is, Alan said it, this is K through 12, under-resourced, nationwide. And what a wonderful way to start it off with the charter school system, which was founded on the basis of being innovative. That was the entire basis for the charter school system. And what a great way to pilot it with charter schools and then expand it out to just very broadly under-resourced K through 12 across the country.
Time for final thoughts. Anything that we haven't mentioned from each of you? Let's start, Earl, with you, and then Alan, and then Karthik.
Just excited to be in partnership with Beacon 22 and OnMed, and particularly excited that the health and wellness of our scholars, family, and staff are now going to be met. So that's all I have to say on that topic.
Jared, I would say, I'm sure you've picked up through our conversation today that there is this mutual deep respect and admiration from all of us who are here together for the work that we are all doing. And what I would say is that it's authentic. The reason why we're doing this is really to make impact in the communities that need it the most. That's why we're doing this. And so that kids and families and communities can be healthy and can ultimately live their best lives. And while that might sound lofty, and when I say we're all here to work to change the world, I fundamentally believe that to my core. And so that is why this is so important, because it is driving to help deliver on that promise of changing the world. I'm looking forward to collaborating with Earl and Karthik and many others who are out there listening to bring this dream to fruition.
I would just wrap it up and say it's time to make it happen. 2026 needs to be the year where healthcare in under-resourced schools across the country wasn't a foreign concept anymore.
That right there is a wrap for this episode. That was a perfect place for us to see this. That might be the end of this episode, but I'm excited for this conversation to continue to watch this unfold for the benefits, for those that we care about deeply, for our communities that feel the benefit as these things continue to take hold and we get to see it happen right in front of us. You can feel the excitement and the anticipation for that among all three of you. I want to thank you each for joining us today. Alan Washington, Earl Martin Phelan, and Karthik Ganesh. Thanks for everything you're doing to make healthcare consumer first. That's what this is all about, and appreciate you joining the show today.
Thank you so much.
Thanks so much, Jared. Take care.
Jared, thank you. Alan and Earl, thank you guys.